All right, welcome back everybody to Heart Smart. Hopefully everyone is buckled up for what's going to be a good talk today in terms of medication use. Some of you might be reaching for some heart medications for this evening, but hopefully that won't be the case. We're fortunate again to be joined by Rachel Carloni, who is our pharmacist with Gator Care, and she's actually going to walk you through this particular module that's going to review with you a lot of the common medications that are used for not just blood pressure, but also cholesterol management too. So she's going to go through a series of slides with you. And just like before, we'll be sure to send out a copy of this presentation with all the slide material. Then you'll also get a real brief post test just to track overall attendance. But really, I would encourage you as well to ask questions and use the chat box. And Rachel is very good about getting back to you about those questions, and whether at the end of today's talk or perhaps maybe a few days or weeks down the road. So thank you very much, Rachel. All yours.
Thanks, John. All right, and as he said, if you guys have questions as I go, just feel free to, I know you can't raise your hands really, but just to enter any questions in the chat box. I also included my email if it's something that you think of later or you just don't want to ask in front of everyone. So today what we're going to talk about are a bunch of medications that patients that have heart disease will usually take to either stop the progression of heart disease or hopefully to prevent it in the first place. So I know a lot of what we're going over on this slide you guys have most likely already talked about, but it's still a good review. So what is heart disease? So heart disease is what happens when the blood vessels or the vessels in our body that carry blood to all of our organs become either damaged or diseased, usually from a different mixture of things. So things such as fat and lipids or cholesterol can build up and cause these plaques in our blood vessels, which lead to blocked blood vessels, and that can cause decreased blood flow to areas such as the heart or the brain, which can cause either a heart attack or stroke respectively, or just the formation of blood clots in the body. This is often also called coronary artery disease, or you might just see it abbreviated as CAD in different medical terminology. So heart disease can cause a bunch of different problems. We kind of already touched on both heart attacks or myocardial infarction, as well as strokes and blood clots, but it can also cause heart arrhythmias, which are basically abnormal heart rhythms. The most commonly known one is atrial fibrillation, or also abbreviated as AFib. And heart disease can also cause heart failure, which is a usually progressive disease, meaning that it impairs the heart's ability to pump as effectively as it should be. So medications for heart disease, the big thing to remember on this topic is that each patient's medication regimen depends on how heart disease affects their body. So remember, not everyone is the same. And even if you talk to your family members, your spouse, your friends, you probably could have 3 people on 3 different regimens. So a lot of patients are going to need more than one medication to help with the various ways that heart disease affects them. So a lot of patients do have hypertension, which is just a different term for high blood pressure. So we'll try to give them medications that can help decrease their blood pressure and hopefully prevent some of those long-term effects. We also will use antiplatelet medications or anticoagulants. These are usually referred to as blood thinners by a lot of patients because there's this conception or maybe misconception that they thin the blood. They kind of help to prevent some clots, but they don't necessarily thin blood. And then last, we also have hyperlipidemia drugs, which is another word just for high cholesterol. All right, so we're going to start by going through some of the hypertension or high blood pressure medications. So we're going to review some of the more commonly used classes of high blood pressure medications. These are diuretics or water pills, drugs called ACE inhibitors or ARBs, beta blockers, and then also calcium channel blockers. So we'll start off with diuretics, or as I said before, these are also called water pills. And the reason that they're called that is because they work by helping your body to get rid of extra fluid and usually salt as well. And by getting rid of this extra volume, that helps to decrease blood pressure in the body. There's a bunch of different classes of diuretics or water pills. There's drugs called loop diuretics or thiazide diuretics. It's not really important to kind of know the difference between the two, but it is important to know that they kind of work a little bit differently and that they all essentially do the same thing on blood pressure. Most of these drugs are usually pretty well tolerated, meaning they don't have a ton of side effects. But some of them can cause some electrolyte changes, usually either with low potassium or low sodium. And then some patients also say that they can have like leg cramps after starting these meds. Usually once you start one of these medications, your provider will have some routine blood work done within a week or so after initiating them, just to make sure that all of your labs are looking okay. So as I said before, there's a bunch of different medications that kind of fall into this water pill or diuretic class. So the most commonly used ones are kind of listed below. I have the generic name first, and then the brand name is behind it in parentheses. All of these are available generically, but I included both names just for completeness sake. So hydrochlorothiazide, chlorthalidone work very similarly. And then the next ones, furosemide, bumetanide, and spironolactone work a little bit different, but they all usually achieve the same effect. All of these, as I said before, are generic and relatively inexpensive. And I know some pharmacies, I think Publix maybe gives away hydrochlorothiazide free of charge, even with insurance, so the pharmacy will cover your copay. All right, so moving on, next we will talk about two classes that are very similar, so we usually kind of group them together just for sake of completeness. So these are drugs called either ACE inhibitors or ARBs. They work slightly differently on a different pathway, but they decrease blood pressure the same way. So they decrease the effects of a hormone that's found naturally within the body called angiotensin. And what angiotensin does is it causes your blood vessels to constrict or get smaller. And by constricting, this substance increases blood pressure. So both of these drugs work to decrease the effects of angiotensin in the body and therefore cause vasodilation or prevent vasoconstriction. So they work very well at decreasing blood pressure. They're very commonly used for a lot of patients. They're one of our first line medications if patients don't have contraindication. And they also have been shown to prevent kidney damage. So for a lot of patients that maybe don't even have high blood pressure, but they're predisposed to kidney damage, such as patients with diabetes, these can be a really good option to help prevent some of that kidney damage down the road. Big side effects, usually they're very well tolerated by patients. The ACE inhibitors can cause a dry cough. If you've ever tried one of these, usually lisinopril is the first ACE inhibitor that patients try. A lot of patients will say that they have a dry cough. It sometimes can go away after a few weeks. Sometimes it doesn't. It is nothing to be concerned about, but if it's something that's bothersome, definitely let your physician know, and they can just change to a different medication that doesn't have that side effect. They both can also cause increases in potassium levels within the body. So it is important to get follow-up labs. Same thing as the diuretics, usually kind of like a week or so after starting the medication. Your physician will usually order some labs just to see kind of where everything's at. And then last but not least, they can also cause allergic reactions, usually swelling of the lips and tongue and sometimes trouble breathing. This does happen more often with African American patients. So if you are taking one of these medications and you do start to experience any of those symptoms, big thing, stop taking it obviously, and if it is kind of an emergency situation, of course, always call 911 or seek medical care because they can be kind of serious at times. So the first list of medications there, those are all ACE inhibitors. So as I said before, lisinopril is the most commonly known one. It's nice because it's just once a day. It is also free at Publix as well. So even if you do have insurance, whatever that copay is, they'll cover. And it's also on the $4 list at a lot of pharmacies as well. So even though you have, a lot of us have insurance, you can still take advantage of those programs where they have free medications or reduced copays. So that's lisinopril. We also have benazepril and ramipril. All do the same thing, but I think lisinopril is just the most widely known of these agents. And then the last bullet point there, these are a list of the more commonly known ARBs or ARBs. Losartan is probably the most commonly known one, as well as valsartan and candesartan. These are also all generic as well, a little more expensive, but I think still mostly on the $4 list at various pharmacies. All right, so moving on, we're now going to talk about a class of drugs called beta blockers. These are not usually used primarily just for blood pressure medications. They're most often used for patients that maybe have high blood pressure and potentially like a history of stroke or a fib or a heart attack. So they're not the best at blood pressure control, but they have been shown to prevent a lot of these long-term outcomes that we can sometimes see in patients with heart disease. So beta blockers work by decreasing how fast and how strongly the heart beats, and by doing that, they help to decrease blood pressure throughout the body. So as I said, they can be used for blood pressure as well as treating arrhythmias. Usually they help to slow down the heart rate. So they're great for patients that just have a higher heart rate, or maybe even patients that have a fib. They also can help patients that have chest pain. A lot of times patients will just kind of have baseline chest pain or angina, and this can help kind of decrease how much oxygen the heart needs, and therefore any pains that you might have. And they're also used to prevent heart attacks in patients who have already had one, by also decreasing how much oxygen the heart needs. These are usually well tolerated by patients. Some patients do say that they can feel some like coldness usually in either their hands or their feet, as well as constipation. If that's the case, it usually is something that goes away with time, usually a few weeks. But of course, if any of these side effects ever become kind of bothersome, of course, let a physician know. So I've listed the more commonly known beta blockers below. Once again, all of these are generically available. We have metoprolol, which is actually available in 2 formulations. So we have Toprol XL, which is once a day, or Lopressor, which is twice a day. Pretty interchangeable. Usually medications that are once daily tend to be a little easier to take, just because you have to remember to only take 1 tablet a day versus twice, but both are great drugs. We also have Carvedilol or Coreg. It is a twice daily drug. It's a little bit stronger of a blood pressure lowering medication than metoprolol, and used also very commonly. Next is Propranolol. This is a little bit of an older medication, usually not used very often anymore. It tends to be used more for patients that maybe have anxiety, especially about things like flying or speaking in public, but you may still have patients on this medication. And then atenolol as well, which is also once a day. All right, and then last but not least, for high blood pressure or hypertension medications, we will talk about a class called calcium channel blockers. And these are medications that help by decreasing the rate or how fast calcium moves into the cells of the heart, and therefore the blood vessels of the heart, which helps to decrease the work that the heart has to do, and therefore decreases blood pressure. So kind of similar to beta blockers in that they help to decrease the work of the heart and how hard it has to beat, and therefore decrease blood pressure, but they work slightly differently. They're used for a lot of the same indications, such as high blood pressure, arrhythmias, once again, usually AFib, or for patients that do have chronic chest pain. Common side effects usually can include things such as dizziness. Sometimes that can just be due to decreases in blood pressure. And usually after taking these for a little while, you can get used to it. Swelling, usually in the lower extremities, so either feet or legs. That's most common with amlodipine, the first one listed there, as well as low or decreased heart rate. So as I said before, amlodipine is probably the more commonly known of this group of medications. Once again, it's another agent that's available free of charge for patients at Publix, I believe. Next, we have nifedipine or Procardia, diltiazem, and verapamil. So all are generically available and all work pretty well at decreasing blood pressure, as well as some of those other side effects or secondary indications. And then just for completeness sake, I wanted to just mention a few of the other blood pressure medications that you may either have heard of or are taking currently. These are ones that are not used as often as the classes that we just went over. But if you do have any questions specific to these about something I don't talk about, feel free to, like I said before, reach out and I'll get back to you all. So the first group are drugs called central agonists. And the reason they're called central drugs is because they work by decreasing blood pressure at points within the CNS or the brain. So the main two medications here are clonidine. That's probably the most commonly known of this group. It's a very fast acting blood pressure medication, as well as a very potent blood pressure medication, as well as guanfacine. These are not used very often because they are often dosed more than like 2 to 3 times a day. And if you do not continue taking them, they can cause what's called rebound hypertension, meaning that your blood pressure can actually jump back up if you miss a dose. The next group are called alpha blockers, and they decrease blood pressure by causing vasodilation, meaning that the blood vessels kind of relax and dilate. They also work on blood vessels surrounding the prostate in men. So they're used very commonly for patients that have BPH, which is a common disease state in men, usually over the age of 65. So the 3 that are available in the alpha blocker class are listed: doxazosin, prazosin, and terazosin. Usually used fairly interchangeably, but also good at decreasing blood pressure. And then last but not least is the vasodilators, and they work similarly to the alpha blockers because they also cause vasodilation or relaxation of the blood vessels and therefore decrease blood pressure. So the most commonly known agent here is usually hydralazine. Usually this is a medication taken 2 to 3 times a day, so it can sometimes be hard to keep up with a 3 times a day medication. So we have minoxidil, which is anywhere from once to twice a day, and then also isosorbide, which is similar to nitroglycerin, and that it can help with some chest pain for patients that have chronic chest pain, but also helps to decrease blood pressure. All right, so moving on, as I said at the beginning, we're now going to talk about both anticoagulants and antiplatelet medications. These are usually kind of grouped together. I'm not sure if it's appropriate or inappropriately as blood thinners. I think that terminology can be a little scary for some patients. So they don't really thin your blood, but they do interfere with how quickly your blood can usually form blood clots. So it may predispose someone to bleeding, especially if you're on multiple of these medications, but they're not necessarily blood thinners. So anticoagulants are used because heart disease can, as we said before, can lead to these buildups of plaque within the blood vessels. Whenever these plaques erupt or get exposed in the body, they can cause blood clots. Remember, anytime there's some sort of disruption within our blood vessels, usually the first thing our bodies do is try to create a clot there to help prevent any more bleeding. So whenever these plaques do erupt, it can lead to blood clots. And if that blood clot does get big enough, it can actually impede or block blood flow to organs that we need blood to get to, such as the brain or the heart. So anticoagulants work by preventing your body from making substances that allow clots to, to form. As I said before, they're oftentimes called blood thinners. They don't really thin the blood, they just decrease the production of certain substances that allow that clot to be made. They're used most often in patients who are at a high risk of a blood clot. So someone maybe that does have AFib or certain clotting disorders, or if anyone has already had a blood clot that predisposes you to having a second one. They're usually not used to prevent heart attacks. The big thing with these medications is that you always want to make sure the benefits outweigh the risks. So the big risk, of course, with any anticoagulant is, of course, going to be bleeding. So usually we use them in patients that are already at a higher risk. So someone that has already had an event or someone that is at a high risk. You may sometimes see these in patients that have had multiple strokes in the past. They will use them to potentially prevent any additional events from occurring. So I've listed 2 bullet points here that have commonly known or commonly used anticoagulants listed. The first one, these are all oral anticoagulants. So warfarin or Coumadin is a fairly old medication. I think it was approved in 1963, or at least in the 60s. And it was for many years really the main oral anticoagulant that we use to help prevent these events in patients. Within the past 15 years, we've had a few new agents released to the market. The most commonly known ones are Eliquis, Pradaxa, and Xarelto. If you're someone that watches the nightly news, these are all brand medications, so they're advertised quite a bit on the news or on the commercials during the news by drug companies. And really these 3 are fairly interchangeable, but they all work similar to warfarin, but don't require as much monitoring and dose adjustment as warfarin does. And then the last bullet point there, these are drugs that are actually used by injection, so not used very often long term. We will use them quite a bit within the hospital to prevent any blood clots from occurring in our inpatients. So heparin, which is once again an older medication, as well as Lovenox or enoxaparin. And we usually use them at lower doses for admitted patients to help prevent blood clots. And then next we'll talk about antiplatelets as well. So this often also gets grouped into that blood thinner kind of group. And antiplatelets, the most commonly known one here is aspirin. But these drugs help to prevent blood clots from forming because they help prevent the platelets from sticking together. So platelets, whenever there's some event that occurs in the body, platelets are the first part of our blood that goes there and sticks together to help create a blood clot. So antiplatelets, of course, prevent that step from happening. So they're very helpful to prevent heart attacks, as well as strokes in high-risk patients. I think a lot of patients are on one of these agents, especially aspirin, or they're used in patients that have already had an event. And the reason that we use antiplatelet medications more than anticoagulant medications is because antiplatelets don't carry as high of a risk of bleeding as our anticoagulants. So you will actually see some patients, and you may be one, that's on both an antiplatelet and an anticoagulant. They do work at different stages in the blood clot formation, but in general, antiplatelet medications have a lower risk of bleeding. A big thing to remember with aspirin is that there's 2 strengths available on the market. So there's what's called a baby aspirin or a full dose aspirin. So a baby aspirin is just 81 milligrams. A full dose aspirin is 325 milligrams. The vast majority of patients that take a daily aspirin should only be taking 81 milligrams unless they've been directed by a physician to take 325 milligrams daily. The reason that it's called a baby aspirin is not because it's for babies. Pediatric patients actually should not take aspirin. It's just because it's a smaller dose than the 325 or a baby dose compared to it. But that's one question we get quite a bit as pharmacists is what's the children's dose of aspirin, and actually kids shouldn't really take it. Other similar prescription drugs that are work in the same way as aspirin, but usually prescribed by a physician would be something like Plavix or clopidogrel, prasugrel, or Effient in ticagrelor or Brilinta. Usually these are used in patients that have had heart stents, but you can also see them for prevention of stroke, especially in patients that have already had one. So I talked a little bit about this, but so should I take an aspirin every day? There's a lot of literature that's constantly changing about the benefits, but also the risks of taking a daily aspirin. It's kind of hard to say a blanket statement for everyone, yes, you should, or no, you shouldn't, because it, once again, is kind of a weighing of the risks versus the benefits. So as I said before, they can cause bleeding. A lot of patients also can have GI upset or even ulcers from taking aspirin. There is an enteric-coated aspirin that you can get, meaning that you just swallow it, and it's coated kind of with a like a nice like shiny coating that helps to hopefully prevent some of the GI upset versus the chewable ones. But your physician should really kind of look at what benefit you should be getting from an aspirin, as well as what risks you have to either have bleeding or an ulcer, and kind of decide based off that. So if they do decide to start you on a daily aspirin, as I said before, make sure that it is the correct strength when you go to the pharmacy. If you ever have questions, just ask. The pharmacist should be able to walk you out to the shelf where everything is and show you the correct product to take. So as I said before, usually a baby aspirin, meaning 81 milligrams daily and not the full 325. And then I believe lastly, what we're going to discuss are cholesterol lowering medications. So I think you guys have probably reviewed this, but remember too much bad cholesterol, which is LDL, if you're ever looking at a cholesterol panel from your blood work, within your blood vessels can cause plaques to build up. As I said before, plaques, whenever they erupt, can cause blocked blood vessels, leading to things such as strokes and heart attacks. So most cholesterol medications help to decrease this bad cholesterol or LDL while increasing good cholesterol, which is HDL on a lipid panel. And of course, all of them should be used in combination with a healthy diet. They work, but they only work so well, and they're going to work a lot better for patients that eat high fiber diets, lots of fruits, veggies, lean proteins, and try to avoid lots of fats and carbs. So the most commonly used class of cholesterol lowering medications, and really the most effective as well, are drugs called statins. And these drugs work by decreasing LDL and increasing HDL. So decrease bad cholesterol and increase good cholesterol that our body needs. They've been shown to actually prevent events in patients with heart disease, such as heart attacks and strokes, as well as improve long-term survival. So patients, if they do have one of those events, will usually be on one of these medications lifelong afterwards. There is also some really interesting literature that they have some other benefits as well, such as helping to prevent breast cancer, even some infections. I know there's some studies going on even within our institution looking at the use of some statins for patients with COVID. So some interesting literature hopefully coming out about that. So the most commonly used statins I listed on the very last bullet point. You can see atorvastatin, which is Lipitor, rosuvastatin or Crestor, simvastatin, and pravastatin. These are all available generically. Some of them are a little bit stronger than others. And a big thing to remember is that if you do have side effects to one, usually patients will complain of leg or foot, like cramping. If you do have that with one of these agents, let your physician know, and they can usually switch to another similar medication within the same class. And a lot of times that side effect will go away. So these are drugs that really are very beneficial in terms of long-term outcomes and mortality. So if patients can stay on them, we try to do everything that we can to keep them on them. And then some cholesterol lowering medications. As I said, ideally everyone everyone needs to be on a statin if they should be on one. And really the other medications listed here are either for patients that really can't tolerate taking a statin every day, or if they still need additional cholesterol lowering after taking an appropriate statin. So the first medication is Zetia. This is somewhat of a newer medication, but this drug helps to prevent the absorption of cholesterol from the GI tract. So it helps to decrease how much cholesterol we actually absorb from our food. It's similar to the next two medications that are listed, cholestyramine or Cholestipol, which is called Welchol. They also help to bind extra cholesterol within the body and usually just excrete it through the GI tract. Fenofibrates or Tricor can also help decrease levels of triglycerides on a lipid panel, as well as increase HDL. And then last but not least, niacin, which is also available over the counter, so without a prescription, decreases how much LDL is made within the liver. It can have some pretty bad side effects. It causes something called flushing, where patients feel really hot and can even get redness on their chest and face. If that's a side effect that you have, let your physician know. There are some low flush or no flush products available in niacin. So last but not least, this is kind of the spiel that I have to go through every time I give a presentation. So just general pointers for taking medications. So try to take all of your medications every day. I know it can be hard to kind of remember, especially if you're on multiple medications, but a lot of them do only last a day's worth. So taking them intermittently can actually cause some bad long-term outcomes. So things that are available to help you take your medications, we always encourage patients to use cell phone reminders. So you can just set an alarm on your cell phone, or there's even some apps now that you can download that will remind you to take your medication at certain times. There's also, of course, pill boxes. There's some really cool ones out there now that even will alarm you as well and record when you take medication, so you can show that to your physician. Of course, also think about using automatic refills through the pharmacy. So lots of chain pharmacies, and I imagine even some communities will do this now, where if it's a 30-day supply, they'll automatically go ahead and refill your prescription, usually 28 days or so after the last fill. That way it's ready. When you need it, you can just go pick it up. There is also something kind of cool that Amazon has started doing, where you can get your medications filled through Amazon. And what they will do is put every medication that you take each day in a specific little package. So each day gets its own package, you open it up, and then that's everything you take that day. And of course, it's Amazon, so they'll deliver it to your house, I imagine probably pretty quickly as well. So as I said before, even missing a few doses can have an impact on your health, especially with things like blood pressure meds, where it can cause your blood pressure to kind of bounce all over, can definitely be kind of a scary thing to happen. So of course, also talk to your doctor. If you feel like it's something that you don't want to call your doctor, maybe you can't get a hold of them, remember you always have access to a pharmacist, even if it's off hours. Of course, call a local pharmacy. There are some 24-hour pharmacies here in Jacksonville, but that's what they're there for. So they're there to answer your questions and help you out with any medication needs. And things to ask your pharmacist: does it look like you're taking all the right meds? Do I have any medications that could interact with each other? So I encourage patients to try to use the same pharmacy. It doesn't necessarily have to be the same location, but for example, if you are using Walgreens, try to just stick with Walgreens. If you use Publix, same thing. And the reason for that is because the databases or the computer systems that they use in each chain, unfortunately, don't talk to each other. So if you fill prescriptions at one Publix, any Publix pharmacy should be able to see what meds you're taking. But if you go to a Publix and then a CVS and then Walmart, they can't necessarily see all that. And if we don't know what you're taking, then we don't know what drug interactions there could be. And then pharmacists have also been trained on things like lifestyle choices and just healthy living. So even if it's not necessarily medication, of course, feel free to ask and they should be able to point you in the right direction. If you are someone that tuned in and have Gator Care, it's always good to know what is covered by your insurance. So there's this website I don't think a lot of Gator Care members are aware of, and it's just gatorcare.org. So super easy to remember. There's a bunch of info on there in general about different parts of your healthcare coverage, any tier changes, recalls, things like that. But if you go to the pharmacy tab, which I believe is towards the right-hand side, there is a bunch of different tools, and there's even what's called the formulary lookup tool. And you can literally just type the name of any medication in there, and it should pop up and tell you whether or not only is it covered, but if it is covered, what tier it's covered at. So that kind of gives you an idea of how much the drug should be. And if you prefer, if it's easier to just call, the back of your insurance card should have the phone number for Magellan. They're the company that we utilize that help administer our pharmacy benefits. They should be there 24/7, and they can also help you figure out what's covered on your insurance, and maybe if you're having any problems, what's going on there as well. So that's all I have for you guys today. As I said before, feel free to reach out if you do have any questions. I know things pop up after, and then it can also be hard to just remember. So I'll wait a few minutes, see if you guys have anything in the chat box. Otherwise, complete the post assessment so John knows that you all were here and awake, and I think that's it.
That's it. Thank you very much, Rachel. Yeah, so if you have any questions, just type them in that chat box real quick. And like we said at the beginning, we'll send a copy of each of these slides. And for those of you that may have tuned in a little bit later, we'll have the recording of this talk placed on the employee wellness website, so you can view that as well at your own leisure, and also fill out that real quick quiz survey that we use basically just for attendance tracking. So with that, looks like I don't see any questions filtering in through the chat. So again, once again, we thank you for tuning in. Next week will be our last class. I know, try to hold back your tears, but we will be talking a little bit more detail about physical activity and also goal setting. And then I'll also be in touch with each of you about setting up your individual health coaching session, just to make sure that everything that was covered here, we do tend to cover a lot of ground in this program, just to make sure that anything specific to you in terms of questions and how to apply some of these guidelines to your life and get some one-on-one attention to. So with that, you guys have a good rest of your day, rest of your week, and we'll see you next time. Thank you.